Hey there, good looking. If you are struggling with a tennis elbow, you need to watch this episode of Ask PJ Anything. I'm going to discuss my 8-month journey with the tennis elbow, what has worked, what hasn't, as well as some of the best exercises and stretches that you need to be doing. So buckle up and let's get started. Hi there and welcome. My name is PJ Wren, and if you don't know who the heck I am, I've been a certified personal trainer and fitness coach for nearly 3 decades. And hey, this is where women, and a few good men, over the age of 40 come to work on living their fittest and fiercest life. It's great to have you pop onto this video series. This is a series that we call Ask PJ Anything. And you can ask me anything. It's here where my Patreon and YouTube community can ask me questions regarding health and fitness. So heads up, if you have a question, we put a link down below in the description. So click the link, type out your question, and we may feature it in a future episode. All right, let's get going. Today we only have one question and one question only, but it's a big one. Olga from the UK says, I have chronic tennis elbow. Nothing helped, and I have to live with it. How do I keep exercising my upper body, damn triceps, if I can't lift heavy with my right hand? Planks bother my arm too, unfortunately. Hi, Olga. Now, part of the question I didn't include, she says hi to George and Bella. Olga, they give you a big hi right back. Oh boy, about your elbow. I feel your frustration. I too have been struggling with tennis elbow, and it's going to be a year in June. For those of you who are unfamiliar with this injury, good for you. Keep it that way, all right? And we're going to keep it that way by following the tips I'm going to outline in this video. Now, if you do have it, hey, stay tuned, because I'm also going to share with you what has worked for me and some things that you could add into your current routine. First off, tennis elbow is actually called a lateral epicondylitis. It's a nagging, ridiculous, painful condition that occurs when the tendons in your elbow, the outside, are overloaded. Now, this usually happens because they've been overloaded repetitively with motions in the wrist and the arm. Now, despite its name, tennis players aren't the only people who develop a tennis elbow. In fact, my physio got really excited recently because a tennis elbow patient came to her that actually got tennis elbow from tennis. Most of her patients are like me, overuse from other repetitive motions that have absolutely nothing to do with a racket. In the fitness arena, you'll see tennis elbow flare up because of all the gripping that we do with dumbbells. The symptoms of tennis elbow develop gradually. In most cases, the pain begins as mild, and then it slowly worsens over weeks and months. There is no specific injury associated with the start of your symptoms. It's not acute, where you're training and then go, oh shit, that didn't feel right. No, it's more of a slow burn where nothing, and then, oh shit, what's going on there? So, common signs and symptoms of tennis elbow include pain or burning, again on the outside part of your elbow, weakened grip strength, and sometimes you can even encounter pain in the evening. The symptoms are often worsened with any forearm activity, such as holding onto a dumbbell, or even twisting a lid off a jar. Heck, even pulling up my pants hurt my elbow and when it was at its worst, because any gripping activity can aggravate an angry elbow. Your dominant arm is most often affected. However, both arms can be affected, and at the same time too. To avoid tennis elbow, it's important to pay attention to any elbow and forearm discomfort when training. Because as I mentioned, tennis elbow starts off with a bit of pain. And the majority of women are going to ignore it. Or they're going to do what they have to do to get through their training session, which is exactly what I did at the beginning. They'll almost never take time off because of a little pain. And a lot of the time, the pain will go away, and this is at the beginning of the injury, during the workout. It'll hurt when you first pick up the dumbbell, but then the body adjusts to the work it has to do. Now that's actually really bad. While the body can do an admirable job of dulling the pain so it can do the work you're putting it through, it makes it very easy to go from tendinitis, which is the inflammation in the elbow for those first few months that you have it, to tendinosis, which is tennis elbow. Tendinosis is more than inflammation. This means now that there is damage occurring at a cellular level, and it is so much harder to recover from. My elbow was a bit flared up, but I kept recording workouts, sometimes up to 3 workouts a day, because I had a huge shooting schedule. And before I knew it, my elbow ached all the time. So if you want to avoid lateral epicondylitis, tip number 1, please pay attention to your elbows and forearms and head straight to a physiotherapist if you start to feel something. And go to a physio who does IMS, and I'm going to touch on that in a little bit. Tip number 2, warm up your forearms before a workout. The tissue needs blood flow, so it's a good idea to increase your blood flow with some exercises. And you can use some of them that I'm going to demo in a bit, or you can simply move your arms in a big range of motion. Tip number 3, scoop your dumbbells when you're picking them up to bring them off the floor. This means you're going to scoop them with your palm facing away instead of pulling them up with your palm facing you. This will place less stress on your elbows tendons, and it really works, so do it. Tip 4, add movements like a kettlebell swing, or is also called a wood chop. Now this exercise will load up your forearm extensors and your elbow tendons with just enough weight to strengthen the muscles without irritating the tendons. And this is because you are not just using your forearm extensors and your forearms period, you're also using your hips, your core, and your shoulders to help with the movement. Tip number 5, keep your forearm crisp when lifting. Tip 6, strengthen your rotator cuff muscles, so this is in the shoulder, behind the shoulder. There is a significant link between rotator cuff weakness and tennis and golfers' elbow injuries. And I'm going to show you a good one near the end. Now, if you are one of the unlucky ones who has tennis elbow, here are a few things you could try. First and foremost, get to a physiotherapist, and one that can do IMS, or what is also known as dry needling. IMS is a medical technique used to reduce muscle pain. It works by increasing blood flow and releasing pain-relieving hormones to the affected area. IMS treatment involves the insertion of needles into the tight muscle bands. The needle creates a tiny therapeutic injury, causing the muscle to literally grab onto the needle and cramp. Yeah, I won't lie, it's a little uncomfortable sometimes. But this type of stimulation triggers a reaction. This reaction allows the muscle to finally relax and the nerves to function normally. Now, this small wound, too, also increases circulation, telling the body to send blood and healing materials and encouraging the healing process. And it encourages the process exactly along that tightened muscle band that it needs. Now, each IMS treatment is cumulative, providing restoration to the muscles until the entire area is healed and free of pain. IMS is effective, and it is a low-risk treatment option. But heads up, it takes time. I have been going once a week religiously for 8 months now. And it is working, but you got to commit to it, which I know can be hard to do, especially if you don't like needles. And then there's the financial burden of seeing a physio each week, or a physical therapist, as they may be called where you are. My appointment is $100 a pop, and I'm self-employed, and I have no coverage. However, being pain-free and being able to lift as I used to is an important goal for me. So I budget so I can see a physio. Now, I've continued to train throughout this entire journey too, by scooping my weights, wearing an elbow brace which redirects the stressful forces away from the injured area, and listening to my body. So if my elbow starts talking to me, I simply adjust the angle of my hand until I don't feel my elbow anymore. Or I get rid of the damn weight on the affected elbow if simply adjusting doesn't feel right. Now, doing these things has allowed me to build my fitness in these last 8 months. Remember, there are always workarounds. Now, me not exercising, she's not a fun person to hang out with. Exercise is my outlet. So for the sake of my marriage and my sanity, I learned how to work around my elbow. Now, I also tried prolotherapy, which is an injection treatment used to relieve pain as well. Your healthcare provider, I used a naturopath, will inject a small amount of an irritant into your body. Dextrose, a sugar solution, is the most commonly injected irritant. Now, this then relieves the pain by jump-starting your body's natural healing properties and abilities. It's pretty cool, and it does hurt like a son of a gun for a few hours afterwards, but then the body starts to heal itself. This technique of inflaming the body so it heals itself is also a reason why ice isn't always the best option. My physio actually recommended against me icing my injury. You see, we want the inflammation because that is proof of the body is healing. By icing or taking ibuprofen or anti-inflammatories, we can numb that area to the point that it gives you a false sense of security, giving you permission to use your hand and arm more when you probably shouldn't be doing it. Now, if you decide to go the prolotherapy route, make sure you use a practitioner who uses ultrasound to help guide the injections. You will most likely need several injection sessions too. It's not a one and done. Usually people receive a total of 3 to 6 injections over the course of their prolotherapy sessions, and it's usually between every 4 to 6 weeks. Costs can vary from $100 to $1,000 a session, and this is really dependent on where you live in the world. My treatment was $500, and for reference, I live near the Vancouver area in British Columbia, Canada. Now, did prolotherapy work for me? It seemed like it did. However, I was instructed not to lift dumbbells for 4 weeks afterwards. That is very challenging to do since my job is literally me lifting dumbbells. If I could go back in time, I would continue with this treatment plan of prolotherapy. But instead, I decided to go back to IMS, go back to my physiotherapist, who I absolutely adore, go back to my home therapy workouts, while also including massaging the area a few times, self-massage a few times a week. Now, if you are really desperate, there's another technique called PRP, which is platelet-rich plasma therapy, and this is used for really stubborn cases. And there's some great research with PRP for the knees, elbows, and shoulders, rotator cuff in particular. In PRP therapy, blood is withdrawn from you, and then it's spun in a centrifuge to extract the platelets and your growth factors. Cool, huh? This fluid is then injected through ultrasound guidance into the damaged joint. Now, I may still do PRP. However, my understanding is it is extremely painful, and most of the people I talked to needed 2 treatments. But it did fix their elbows, and they tried everything. Now, cost of PRP treatment can vary widely from $400 a treatment to $3,000. So if you opt for this route, please do your homework and talk to others, and also make sure that it's ultrasound guided. All right, now let's look at 7 exercises and 3 stretches that will either help you avoid tennis elbow, so you can use these as warm-ups, or if you're on the healing end of it, speed up your process. Now, a little disclaimer here, all right? The following exercises are simply meant for educational purposes. They're not meant to diagnose or to treat. And if any of these exercises cause pain or discomfort, stop, okay? If you have tennis elbow or suspect that you do, hey, make an appointment with your physiotherapist to get assessed. Now, for each of these exercises, with the exception of the stretches, I recommend you try them without a dumbbell, so body weight only, and then build slowly to load it. All right, first up for the exercises is my favorite, and it was a game changer for the last time I had tennis elbow, which was like 20 years ago. But it's a finger stretch with a rubber band. Now you can do this exercise multiple times a day, 10 to 15 reps. And if you don't like trying to hold on to a rubber band, you can actually purchase a finger extensor band like this one. I got mine on Amazon. I do three to four sets of 12 reps every night, and I simply do it while I'm reading. Second exercise is wrist extension. Now, if your elbow is really sore, you may still be able to do this forearm extensor exercise by performing an assisted extension. That's how I actually began. So you help the hand up and then focus on the eccentric contraction for the extensors by lowering the weight slowly on your own. Work up to be able to do the whole rep unassisted. Whenever I train, this is what I always do, and I do 3 sets of 12 reps as a warm-up. I use a 5-pound dumbbell, and when 12 reps become easy, I'll try an 8-pound for 8 reps, and then build my reps up to 12 again. It's important that you add just enough load to strengthen and not to irritate. From there, flip the palm up and perform a set of wrist flexion curls. Third exercise is supination and pronation. Now you may see this one on the internet with people holding on to a hammer. But you know what? You can hold on to a light dumbbell upright. That'll work just as fine. You want to slowly rotate your forearm so the palm is facing down, and that's what we call pronation. And then slowly pull the dumbbell up so the palm is facing up for supination. Again, start slow and light. Remember, there should be no pain or discomfort. I use a 5-pound for this exercise. The fourth exercise is a radial deviation with a weight. Start with a light weight or even a soup can. Thumb on top and go up and down. Aim for 10 to 12 reps, 2 to 3 sets. From there, we can move on to strengthening the rotator cuff. My favorite is a side-lying external rotation lift. Using a really light dumbbell, so 1 pound, 3 pound, or 5 pound, rest your elbow on top of a rolled towel on the top side waist. Keeping the elbow on that towel, lower the hand to the belly, and then lift the hand and lower arm up as high as you can. Aim for 2 to 3 sets, and you want high reps for this one, 20, 25 reps. And then after your workout, there are 3 great stretches you can do for your elbow. The first is the wrist extensor stretch. Now the tip with this one is to rotate the fingers away from the midline of the body. The second stretch is the wrist flexor stretch, and you might be familiar with this one because we do a lot of this particular stretch in my workouts, and it feels so damn good. And finally, I recommend a neck stretch, since it's believed that some tennis elbow pain actually starts in the neck. In this stretch, you've got the arm behind you, palm facing away, and then you're going to gently pull on the side of the head to stretch the side of your neck. I hope that helps you. Thank you so much for joining. And listen, you can help this video out by clicking that like button so that it gets noticed by old YouTube and the algorithm. Thank you so much. Now, if you have a question, the link is down below for you to submit yours. And like I said, we may feature it in a future episode. And listen up, if you want more workouts, fit tips, nutrition advice, and regular doses of motivation to keep your momentum going, hey, I invite you to come and join us over on Over 50 Fitness. I've got a 14-day trial link down below. Now, if that does not interest you, we could still support you and your fitness journey over on Patreon. And in return, you can help us to keep this YouTube channel going. Thank you so much for watching. I really appreciate it. I've said it before, if you don't show up, it'd be awfully lonely here. So thank you. I look forward to reading your comments, and I will see you in the next video. Bye. Hey there, good looking. In this episode of Ask PJ Anything, I am talking everything there is that I know I don't think that makes sense. How to manage it? I knew I had to answer it in this episode. In this episode. Hey, this has absolutely nothing to do with your elbow. I just wanted to share this amazing hand cream. Vaseline Intensive Care Hydra Strength. It is so good, and it's completely non-greasy. I'm addicted to this stuff. Give it a try.